To meet the extraordinary challenges of COVID-19, we trialed and we embraced the robotic process automation from UiPath. Thanks for your great help to reduce the amount of time spent by the IPC team on administrative tasks so that we can provide more essential services to the hospital.
You were expecting automation to lift the burden off your staff. And can you tell us how it's done that?
So far, the hospital have analyzed 4,001 COVID tests, and out of this, around 3,887 were processed in-house and 524 patients were detected for COVID-19. Identification and prevention of healthcare-associated COVID is a challenging task, and we conduct surveillance to critically analyze the data, and which involves like identification of their date of admission, transfers within the hospital, patient and staff contacts, their length of stay, ICU admissions, so on. So the trial has saved a substantial amount of time by collecting this data. So the robot helped us to collect this data. So infection prevention control nurses utilize the time saved from this robot process for more essential services such as PPE training, responding to queries as they arise, and provide the guidance and support. So in addition to the COVID data collection, the robot will also assist us in extracting the lab results for multiple antimicrobial resistant organisms called as MDROs, such as CRE, CPE, MRSA, VRE, ESBL, etc. So this is we use a very old laboratory system that is developed in 1980s, which has its own limitations. So on average, a member of IPC team takes 3 hours a day to complete this process. So this is a tedious, repetitive task which no one enjoys completing. It has become increasingly difficult to complete this complex administrative task whilst trying to manage a real pandemic. I have Dara here, and Dara experienced the benefits of it last week.
Obviously, I came into work one of the days last week, and one of the team members was actually off sick at the time, and we had another 2 members of the team who were new to the department and weren't trained completely in downloading the lab results. So I was tasked to the job of downloading the lab results that day. However, when we came in the morning, we got a call from the stores department to let us know that there had been increased use in PPE, and we were running short in PPE, so we had a bit of a PPE crisis. So we had to manage that day, and we had to train staff on using additional types of PPE to make sure they were adequately prepared. So as a result of this, there was no time for me to be able to download the lists, and my 2 colleagues that were working in the department with me that day weren't able to do it. So I rang the lab to see if anyone there could help us, one of the microbiology scientists, to help us maybe download the list that day. And I was surprised to find that someone had already done it. So I know UiPath were testing the robot, and it was during the development stage, so we didn't realise they'd progressed so much already. So Lavinia kindly was able to provide us with the MDRO list that day, so that we could action the results, which was fantastic, and it really, really helped us. And they really gave us the results when we needed them most, which was so important.
Now you've seen the potential of automation. Where else do you think it could be used to the benefit of the Mather Hospital?
To be honest with you, Mark, the potential areas for application for this robot is endless. Any department which spends a significant amount of time on a repetitive administrative task could benefit from the robotic automation process. Like for example, inside the hospital, it could be an advanced nurse practitioners, specialist nurses, doctors. If you take outside doctors and nurses, like medical records, patient waiting lists, phlebotomy, X-ray and outpatient appointments, quality department, transformation office, finance, procurement, and IT, the application is limitless.
You previously talked about the time that was being saved and what that's allowed you to do, and how this has been, like, in reality, how do you see automation, the time it's saving you now, and how do you envisage it being used in the new normal?
Every worker's the most valuable asset is their time. So once the burden of this repetitive task can be lifted, the department could use the existing resources in an innovative way to decrease the healthcare associated infections, decrease the hospital length of stay and associated cost, improve the healthcare worker engagement and satisfaction, reduce the turnover of staff, improve compliances, and reduce the human error, which is really important. So the time saved by using robotic process automation software could be directed towards auditing and feedback, patient care, and education involving both staff and patient, and quality improvement initiatives. So the key is to free up the resources to deliver the services in a more impactful way.